This is Steve Zeltzer with the United Front Committee for Labor Party. The United Front Committee for Labor Party was formed to build support in the United States for a mass democratic labor party, and also to work in united fronts around the fight against fascism and the defense of workers around class struggle issues. And one of the other areas that we've been involved is international solidarity with workers in Argentina and other countries on struggles that workers around the world are engaged in, because we see the struggle of the American working class tied directly to the struggle of workers around the world and their issues. So tonight's panel, today's panel, or this morning's panel, wherever you are, is on the issue of the fight against COVID zero, and the growth of the right wing. And what we can say, and our speakers will go into that, is that the growth of the COVID pandemic has also been tied to the development of right-wing organizing in the United States and internationally, and using some of the ideology of the right wing for that purpose. So that's why we're having this panel to talk about the issues of COVID, fighting COVID, and also how the right wing is using the COVID issue and the pandemic internationally. So our first speaker from Australia, Melbourne, is Davey Heller. He's with the Australian Service Union. He's a delegate to the White House Council, and also he's a member of Class Conscious. So welcome, Davey.
So basically, suppression strategies have been or in the process of being abandoned around Australia. So after the outbreak of the Delta in July, variant in July in Sydney was allowed to grow and spread to Melbourne and New Zealand, the push against suppression as a strategy by big business really kicked off in Australia. It allowed the ruling class to push the idea that living with COVID was the only option because Delta couldn't be controlled. The experience in China and Taiwan is never discussed in the press, nor is the fact that suppression in the majority of Australian states was still working is really acknowledged. Winding back public health measures was also justified by the high vaccination rates that we now have in New South Wales and Victoria, as people rush to go out and get vaccinated in the face of the Delta outbreak. So we have about 90% of adults are now vaccinated in Australia's most populous eastern states. Some of this was due to vaccine mandates, but actually the vast majority of the working class in Australia was pretty keen to get vaccinated. Like elsewhere, lower vaccination rates are associated with social disadvantage. And so, for example, some of the lowest vaccine rates are amongst Australia's Indigenous populations. So heading into Christmas, all except one of the Australian states that were suppressing COVID is taking the extraordinary step of deliberately allowing COVID into the state by abandoning all internal and external border control. Yeah, I'm not sure if we've ever really seen a situation where governments have set a date to allow a deadly virus into their populations in such a kind of deliberate manner. The international borders are now all being opened up with no real quarantining occurring. Quarantining of international travellers had been the cornerstone of Australia's suppression strategy. The emergence of Omicron has not changed these plans one iota. All it's done is that they are bringing forward the booster program to try to acknowledging Omicron, but that's it. They're not taking any other measures except yet this week they brought forward you can get your third booster from 6 months to 5 months. In terms of deaths, there's been over 1,000 deaths just in New South Wales and Victoria due to Delta outbreaks in the last few months. Now, this doesn't seem a lot compared to a lot of places in the world, but all these deaths were unnecessary, and the level of disease has placed the underfunded public health system under a great deal of stress. And so caused other suffering. So, our ambulance services have been put under a lot of stress. People have been calling the ambulances when they've been having heart attacks and they just don't arrive in time. So incidents like that have been occurring increasingly. It seems all but inevitable that with cases rising in coming months, with Omicron and very few public health restrictions left in place, we're going to look at it's looking pretty likely that we're going to have a wave coming in Australia. So But we're experiencing a paradox. So even though public health measures and lockdowns are all being wound back, the borders are being opened, at the same time, we're seeing a growth of far-right rallies under the banner of freedom rallies, which are growing in size as public health measures are wound back. So this is kind of weird. In Melbourne, where I live, we've seen rallies of tens of thousands in recent months under the banner of these freedom protests, not just against vaccine mandates, but against any public health measures. Like elsewhere, these protests have become a breeding ground for the spread of far-right ideology, conspiracy theories, and anti-communism. It's fueled a wave of far-right violence, particularly targeted at social democratic politicians, health officials, unions, and workers. Like the January 6 insurrection in the US, we've had people bring gallows outside the Victorian Parliament at some of these rallies. They've burnt effigies of our premier, our Labor premier, who's been labelled a dictator. Incidents of real and threatened violence are played down by the press all the time as isolated incidences, such as a man brandishing a crossbow outside Parliament. There've been lots of death threats made to politicians and also health officials. We've had retail workers. We had a retail worker in a bookstore in the city thrown down an escalator and knocked unconscious for enforcing the vaccine passports. And we had a very disturbing incident a couple of weeks ago where a nurse outside a COVID testing center was run over by someone in a car and hospitalized. However, the rallies continue to get large and largely uncritical and massive coverage in the capitalist press. This movement now serves a number of purposes for the ruling class. In the short term, they've created a movement which will make it much harder to reintroduce public health measures that cut across business interests, if and when cases start to rise again. And in the long term, the seeds are being sown for a far-right Trump-like movement in Australia to shift the whole political processes even further to the right and to act as a battering ram against the working class as the capitalist economic crisis and deepens, and Australia, as part of the US alliance, prepares for a possible open conflict with China. The myth of Australian exceptionalism needs to be abandoned. It can happen in Australia. We already have a far-right Liberal government headed by the evangelical Christian Scott Morrison, and this government has openly flirted with the new fascist movement in the hope of harnessing it electorally to stay in office. Just for example, just the other day, one of the so-called dissidents from the Federal Liberal Party, they keep them at arm's length, but he's in the government party and in Parliament, appeared on Alex Jones's show in America. So to talk about COVID, and it got a bit of media attention here because Alex Jones compared our quarantine camps to Auschwitz, and this politician just laughed at that. So, they're openly flirting with these forces and making links internationally. The crisis of COVID has created and accelerated a dangerous situation in Australia, just as it has internationally. There's been little organised resistance from the left against the abandonment of suppression of COVID-19 in Australia. There has been a campaign called Health Before Profits, which was created largely by the group Socialist Alternative, but now this is largely a social media campaign. A small group of doctors and scientists are very active in lobbying and social media campaigning as well. But what has largely been missing in the US and in the UK is the trade union bureaucracy. Not only have the trade union bureaucrats been complicit in the pro-business reopening, but they're not mobilised in any way against the far-right movement that attacked a union office in Melbourne a few months ago and has targeted workers and targeted their political patrons in the Labor Party. The Victorian Trades Hall Council's only response so far has been to create an online petition calling for a royal commission into the rise of the far right. That's it. They haven't backed. That's it. That's been the entirety of their response to this. The bureaucracies have been absent from the two counter rallies that have been organised in Melbourne over the last few months under the banner Stop the Far Right. These rallies have been attended by rank and file unionists, and a few motions have been passed at local branch levels in support of the protests, but the bureaucrats have stayed away entirely. These protests, whilst much smaller than the right-wing rallies, we had about 1,000 people at the first rally on November 20th, and we had about half that on December the 4th, have at least broken the monopoly of the far right and their anti-public health rallies on the streets of Melbourne. I think they also have some international significance because I don't think there's been a lot of countering of these rallies on the streets around the world. So it's been pleasing at least to see that development in the last month in Melbourne. It really points, though, to the fact we need a united front of trade unionists and other organisations who understand the threat of fascism, and this needs to be created in Australia. In the context of the COVID crisis, the fight against fascism and for public health are inseparable. Whilst at the moment, the political forces fighting for COVID-0 in Australia are not strong, I think the situation is very dynamic. People are told 100 times a day when they listen to the radio and telly that we live in a post-pandemic world. And because of our high vaccination rates, we just simply don't need to worry about the virus anymore. But with Omicron's arrival or with future variants as they continue to create chaos, and the example set by Taiwan and China will become harder to ignore. I think already we're seeing a slight shift. Just I've noticed on social media, just in the last couple of weeks, a lot of people were really happy to think that coming into Christmas, things were kind of over with so many people having 2 shots. But with Omicron, now we're all being told 2 shots, you're not vaccinated. And particularly if you've got the AstraZeneca shot. So you're not fully vaccinated. So already people are shifting and that are shifting in their mindset. I sometimes think the situation is a little like the falling of the working class in 1914 in Europe, when they were swept up in the attitude of social chauvinism and they were told the boys would be home for Christmas. A few years later, these lies had worn thin with enormous revolutionary consequences. How will the working class respond to the ongoing COVID crisis when it becomes clear that the ruling classes have no solution to this or any other crisis facing humanity?
Thank you, Davey. I appreciate that. And that's useful for American workers and workers around the world. So our next speaker is Dr. Nayvin Gordon, and he's been active in fighting for a COVID-0 policy in the United States. He's a public health family doctor in the Bay Area. So welcome, Nayvin.
That was an excellent report. Thank you very much. I mean, there's so many similarities between your situation and the US and Europe. The parallels are pretty close. I'm not really going to speak much about that. You covered that pretty well. That clearly was what happened in this country to stop all kinds of public health measures, beginning with Trump. You know, let's free Michigan, let's free everybody from the public health measures. The only thing I want to add is just a short synopsis. I mean, we all know now that, and we can see over 2 years how this virus has mutated to become more and more effective, and now it's exploding. What is it? 3 times? Does it doubling time in 3 days? Is it 2 to 3 to 5 times more infectious? I mean, what we're talking about now is a virus, a respiratory virus that's beginning to equate, if not surpass, measles in terms of its infectivity. So extremely dangerous situation. My feeling is, just to add to your point, the one point to add is that not only has China shown that it can be stopped by public health measures, primarily public health measures, and Taiwan primarily public health measures because they controlled it long before the vaccine came out. But now Cuba is added to the list. They now have eliminated COVID through a combination of public health measures and their own 2 or 3 vaccines, which may in fact may be even better than the ones we've got now. So it can be done. It can clearly be done. Eliminating COVID can be done anywhere. So to me, we don't need to really talk about the science much anymore. This pandemic is primarily a political problem. Its solution is primarily a political problem. And until the working class and its allies can mobilize themselves to force the elimination and eradication of this virus, the ruling class will continue to do what it's doing. So the onus falls upon us somehow and I believe it has to be done through some kind of caucuses on the job, where the primary issue is protection of our health, and that we demand that they protect us at work. And the only way that would happen is if the workers on the job, in the schools and elsewhere, absolutely refuse to go to work or work unless certain conditions were met by the employers. So, in a nutshell, the solution to this problem is political. It's not scientific. There's no more science that we really need to know. We know what we have to do. It's just how we're going to get it done.
Okay, can you, maybe you could talk a bit about the new virus and how it's being, if there's any difference between the old virus and as far as what is the difference?
Well, a lot of it is not that well known. What we do know is that it's much more highly transmissible. If it's doubling time is now estimated to be about 3 days. So it doubles twice as fast. So it's growing exponentially everywhere. And what that means is that we're going to have twice as many people infected, which means the numbers of people who get sick and the number is going to rise exponentially. Within a month, you can see where the numbers are going to go. Just make a short calculation. This is exponential growth at a much more rapid pace than it was before. And that means, wherever you go, your chances of getting infected in a restaurant, which are all open now. I mean, I just went to pick up some food the other day, and the restaurant, a small Japanese restaurant, was packed. There are only 2 tables that were empty, and people had masks off, were eating, and there's staff, and it's very tiny. So that just means millions more people will very quickly be infected. So that it's much more dangerous. It's just going to accelerate the epidemic, and the wave could be much larger than any wave we've seen before. And the other thing that I wrote about shortly just a few days ago is that what's not really discussed is the fact that anyone who's infected by the virus, whether they're symptomatic or asymptomatic, their body is damaged. Their body produces autoantibodies against various tissues in the body, in particularly against the immune system, which means that the immune system is more prone to being infected by the next virus, or the next time you get infected, you're less able to fight any infection. And also you develop within a few months problems with other organs. So in essence, everyone who is infected has a risk of being damaged in certain ways, either central nervous system, vascular system, and the immune system by this virus. So 50 million people are infected already in the United States. Who knows what the consequences are going to be for that? So we're really in a situation where humanity is going to be significantly damaged by this virus. And it's a very dangerous situation. I mean, I think more information specifically will be coming out as they study it. The one point I want to add about the criminality and homicidal policy that's being instituted, outside of these few countries we mentioned where it's being controlled, was Dr. Gupta was on MSNBC News the other day, and I have the date, but I couldn't find the copy of what he said. I actually listened to him, and he said, someone asked him, he said, well, I understand now due to Omicron, Europe is instituting certain relative lockdown measures, social distancing measures and social health measures. And do you see that coming here? They asked him. And he said, oh, we've already made the calculation. We know we're going to lose thousands of people every month for the next 6 months. I mean, he said that right there on MSNBC News. So there's no hiding what they're doing. They're just allowing people to die, and they will continue to allow people to die. It's a very political decision, and it's up to the working people to stop it. They're not going to stop it.
Okay, thank you, Nayvin. And our next speaker is Charles Rachlis, is a retired industrial hygienist with Cal-OSHA, member of the CWG, and he has been speaking out about the need for proper ventilation, protection, masks, and even mass testing, which is a protocol which does not exist in the United States. So welcome, Charles.
Actually visiting a family in Brazil, and before I present my prepared comments, just a few observations from the last few conversations with family and being around here. One was that Bolsonaro, who got sick last year and had gone to New York for a UN meeting, while he was there, his wife decided to get vaccinated, but he refused. and he told that to Boris Johnson, who asked him if he was vaccinated. So we have a lot of that same right-wing anti-vaccination politics, ivermectin, hydrochloroquine fantasy going on down here, and a lot of confusion around that. And I've run into some friends of family who one member of the family will push another member to get vaccinated. Otherwise, they'll separate for a period of time, and it's been a little influential. At the same time, in the last few days, Brazil has decided that you can't enter the country without a full vaccination card presented. And indeed, in restaurants, if you want to go inside, you're required to have a vaccine card, which doesn't mean that everyone who gathers at bars and restaurants is acting in a safe manner. Many people who are outside don't have to have a vaccination card, and they gather in large numbers, close in with each other, and 2 or 3 drinks down the road. Everyone's loud, just as if it was a college party. So just that as an intro to my comments, and I'll get into them now. So with the Omicron variant spreading at close to, it's been suggested 10 times the pace of the previous variants, even if it is less severe in the outcome, the infected can become a petri dish for the gestation of new variants, and they indeed may be more severe, and we just heard the exponential growth of that from Dr. Nayvin Gordon. The SARS-CoV-2 has always been spread as airborne transmissible, something that's now just mentioned in the New York Times yesterday in passing, as if they never denied it, right? And that's something that industrial hygienists have understood from the beginning, and we had guidance, as I mentioned before, and I will again. I was working at Cal-OSHA as an industrial hygienist and safety engineer, and we had Title 8 5199, and those who have desire to read it can look it up, and it's very clear through Appendix A that it requires novel viruses to be treated as airborne until the characteristics are sussed out. This regulation was ignored, except in the rear view mirror when citations were meted out after hospitals, including Sutter and Kaiser, hid behind the fake science presented by the politicized, trumped up WHO and CDC, who claimed it was first airborne and then backtracked and said it was droplet, and stuck to that for months and months and months. There have been a number of presentations made, and I think we presented one of them in a previous forum about by medical historians who've traced the history of the droplet versus airborne controversy, which goes back a century. And has served to a certain extent as an excuse for the misdirection which came from the top. But although that bit of academic history is germane, it's not an excuse for the leaders of the scientific community to have ignored what was well understood by industrial hygienists and regulated in California, at least by Title 8 5199. The upshot of which was that the WHO and CDC and public health guidance took upwards of 7 months after the first few million of deaths worldwide to catch up with the science we've been explaining since March of 2020. We argued then that the PPE supply chain collapse was a consequence of the capitalist application of the division of labor to chase profits by offshoring and concentrating production to low-wage factories in capitalist China, where workers were kept in line by the brutal Stalinist fake Communist Party bureaucrats and red princelings who collaborate with foreign investors to extract surplus value through super exploitation of the Chinese workers. Workers who are denied the basic right to speak out and unionize, and who are illegally worked for long hours much longer than one would expect from a so-called communist country. Now we're into year 2, and the capitalist regimes, particularly in the West, but increasingly in the East, have come to accept that your lives are not worth protecting, and they have no plan to prevent the pandemic from becoming endemic and to apply the science of industrial hygiene to public and private spaces, despite the fact that these principles are known and taught and understood in every public health academy and institution. In other words, the public health community has been reduced to an arm of the vaccine industry. Safe schools and safe workplaces require adequate ventilation, airflow, filtration, and proper types of masking. N95s are the standard, but they are not made universally available. The KN95s are similar, but cannot be fit tested. And so despite having proper filtration material, their loose fit makes the more effective than the level 1 and level 2 surgical masks, but not as effective as the N95s or even the N99s, the half face mask with the HEPA filters. The population has been pandemic weary for over a year now, and the people are getting sloppy. Although being outside is ideal for unmasked activity, when large gatherings of unmasked people outdoors, they can become super spreader events, especially when alcohol is involved and people get close and loud, as mentioned before about my observations on the streets here during my visit here. The capitalists tell us that we're all in this together, but when working people suffered 6.8% inflation in the US, the bosses have been holding the line on wage increases the best they can. New Yorker this week claims that wages have risen 4.8% in the last year, but anyone in a third grade education can see that that means workers have suffered a 2% cut in pay across the board. And despite mass strike sentiment and willingness of the working class to strike and fight back, as exampled by the stationary engineers, the nurses and pharmacists at Kaiser Permanente, the bosses have held the line at 3%, and the union leaderships tied to the Democratic Party have pushed tentative agreements and settlements that lock in 3 to 4% pay cuts as the standard. In other words, they give them 3%, but they're losing close to 4% compared to inflation. To win, workers need militant union leaderships which don't play softball with the capitalist Democratic Party. We need our own fighting workers' party, which uses class struggle methods, picket lines that are solid, and shut industries down. This means our class must break with the Democrats and build class independence to establish a workers' government. The capitalists have had their chance and failed. Millions are dead and there's no end in sight. Indeed, the Democrats are running scared because with inflation and all that propaganda the right wing can throw at them for their failures, it's not unlikely that the Republicans will have a strong chance in 2022 and 2024. We say the only way to stop the resurgence of a fascistic Trump and the fascistic movement is to build a fighting workers' party that mobilizes the working class in its own interests and in its own name. We need a workers' government because only a workers' government can marshal, or not can, but will marshal the resources to build out the ventilation systems, to make the public gathering spaces such as work and school safe, to do the educational work to ensure that the masses understand the science of airborne transmission and how to stop it, to put the factories to the task of providing sufficient PPE and medical equipment for every eventuality, to provide regular rapid testing, identification of all cases, to isolate and provide for the needs of the sick and their families. And most important, to provide the production capacity and resources to all corners of the globe. to stop the spread, regardless of the cost. The big capitalist countries, the imperialist countries, have refused to do the job. And this means that the intellectual property rights that they covet must be abrogated. Big pharma must be nationalized without compensation to the big capitalists and must be run under workers' control. Likewise, the big insurance companies and the medical providers need to be socialized. With the capitalist mandate for profit over nature and over humanity, we know this is the first pandemic of the 21st century, won't be the last, as the habitats are being destroyed and zoonotic diseases emerge. Thus, for humanity to survive, capitalism must die, or basically be put to death by workers' revolution. For workers' revolution to be put on the agenda, we need a revolutionary workers' party and a workers' international to unite the workers of the world in the task. And for that, we need a transitional program based on the 1938 program of the Fourth International. Thank you.
Before we go to our next speaker, Catta from Taiwan, I wanted to talk a bit about our struggle here in San Francisco around defending the students and faculty and staff at San Francisco City College, a community college, because we have been fighting to have a mass testing protocol, proper ventilation, and free mass for all the students, faculty, and staff. And what's happened, and I think it's we can talk about it in New York as well, is that the union has not fought for that. The union has gone along with management. The management of City College, as well as other institutions, colleges, has gotten a large amount of money. They got $51 million. They're refusing to allow the students, the faculty, and the staff to know where that $51 million went. In the course of 2 years, they haven't ventilated the rooms. They don't have a protocol for testing of people who come on the campus, mass testing. And that is true on a national level. 2 years after the pandemic, people still have to get tests by searching them out in private pharmacies, which you think after this pandemic, they would provide mass testing, but it's not the case. So what that says to all of us is that they're not really interested in crushing the disease, because you have to be able to have testing so you know who has the disease, so you can have quarantines. And the latest thing today is that the companies now are saying, let's not shut down anything because it costs money. It's profit. And I think that that's really what is behind the drive to keep open regardless. And there have been wildcat strikes at auto plants in the United States where workers have gotten sick. In fact, at a UAW GM auto parts plant, an officer of the union saw people being carried out of the plant who had COVID. And his name is Travis. He reported that on his Facebook page, that there was a serious problem in his factory. He was turned into management by another UAW official, and he was fired. He was terminated from his job. In other words, the union there, in their labor management, collaboration management, were actually helping to terminate he was a bargaining committee representative of that plant, and they were turning him over to be fired. So the situation in our labor movement in the unions is that the labor management partnership that unions have in the United States has led to a situation where they're colluding with management in refusing to fight to protect the workers. And I want to also add, in the San Francisco labor movement, there are workers who have decided not to get vaccinated, and they're being prevented from negotiating for city workers because they don't have a vaccination, even though they could have a hybrid vaccination. At the San Francisco Labor Council, the members voted to have hybrid or have a Zoom meeting, and the leadership turned that over undemocratically and are forcing the delegates to come in physically, even though that some delegates have vulnerabilities. So what that says is that the concern about the health and safety of the workers, the delegates, the union members, as well as the public, is of secondary concern than continuing business as usual. And that is there are already 800,000 people have died in the United States. You could have millions more die if you allow this virus to continue unabated. They are now saying it's endemic in the United States. that we have to expect to live with it, and it's going to be with us forever. And at the same time, the New York Times and the corporate media are demanding that China, and I assume Taiwan, end their zero COVID policy. So while people are dying in the United States, nearly 1 million, up towards 1 million people, they're attacking China for the zero COVID policy, which raised the question of what the policy is. I think it's a death policy in the United States that we have here. And I think we have to confront that political logic of that action of what's going on in the United States, because it is a death policy, and many, many more people will die. There are thousands of people who are getting infected. I mean, and people are, particularly in the hospital, healthcare workers are overburdened, they're stressed out, and they're anti-vaxxers who are organizing in the United States are blaming them and saying it's a fake virus, even when they're dying. So you have an ideological crisis as well, that the right wing and the supporters of Trump saying you should not pay attention to the virus. It's just like the flu. And that's what they're telling people in the United States. So that is a serious question. And the right-wing fascists are organizing at these anti-vaxxer rallies. Here in Italy, there was a demonstration against the mandate, and the right-wingers joined that in attacking the Trade Union Federation in Italy. So these are being used politically, and something we have to take very seriously. So that's the point I wanted to make. So our next speaker is Catta Yu-Hsuan Chou. She's executive director of CTTU, Confederation of the Taipei Trade Unions, and president of NPOIU, the nonprofit organization representing industrial workers. Welcome, Catta.
I would just want to give a very brief situation briefing about what happened in Taiwan. So thanks for Steve's invitation for me to be here. And I'm right now the executive director of CTTU, which is a umbrella union in Taipei City. And at the same time, I'm also the president of Taiwan nonprofit organization Industrial Union, because I'm right now working for a nonprofit organization. So that's pretty much of it. And so I'm sorry I missed out the previous speakers, because I thought it was, you know, the time in the afternoon in Taiwan, but somehow the time lag doesn't really work that way. So yeah, but anyway, so I have a very quick research about what had happened in the States. And I found out that there was several peaks in the past couple months, and especially the one in November, you know, the one in the end of last year. But the map scenes in Taiwan is very different. As you can see on the right-hand side upper, there's a statistics about the cases confirmed in Taiwan. And in the very past time, it was actually very limited. So, sorry. So you can see that the peak actually happens in May. So from the very beginning, since last year, we only have like a handful case. It's like within 10, 20 something every day. And usually they are more or less from abroad. So they come from the custom, they're from different countries, and they came into Taiwan for the vaccine, or, you know, they're just coming back to Taiwan. So anyway, during that time, last year in around like January, we began to have the masking policy, and it is mandatory. So during that time, there are a lot of people, you know, like rushing for the mask, and the school was suspended for 2 weeks because of the pandemic. But anyway, later on it begins. So that's how it happened in Taiwan. However, our government began to have the border control very early in January. So there were very limited cases from overseas. And then we go to earlier this May. This is actually the peak in Taiwan. So we had a great number of cases in the area in Taipei City. And this area is actually a quite disadvantaged area. So there are a lot of like poor people or people of the working class living in this area, and it happened to become the place where there are the most condensed confirmed cases. So, but the peak was only around like 200 something per day cases. So compared to the States, the number seems like, it's not that much, but well, because of the number of population is very different from Taiwan and America. So that's the difference. So then our government raised the alert to the level 3. So that means that there are a lot of measures that you should not do. Like, for example, there is no dine-in. So the restaurants mostly have to do takeout, or they probably shut down. And there should be no gatherings more than 3 people. And if the services is not essential, they will be suspended. Like, for example, library and public gym, they're all suspended. And they only maintain the essential medical services only. And this kind of situation lasts for around like 2-3 months. So at the end of July, we almost control the situation. So we had very limited cases again, and so we are down back to level 2 again. But right now still, so we continue to have the vaccination. So as you can see that we already have people who had the vaccination. Like, for example, people have the first dose is already almost half, 45%. And well, there are still some people who refuse to get a vaccine, but anyway. So it somehow right now, it seems to be back to the normal, like back to where we were in, last year. So the pandemic situation in Taiwan is actually quite peace in a way. Yeah. And today, because Steve mentioned that you guys want to know more about what had happened in the medical industry. And there was the Taipei City Hospital is also one of the members of CTTU. So we had these quick briefing about what had happened in Taiwan. So the workers in the healthcare industry, they actually having a lot of problems, although we already know that since last year, there's already the pandemic. And, supposedly we should be prepared because we are not that in a very severe situation, and supposedly we have the time to get prepared. However, it seems that the hospital didn't really get to, do the planning and the thing. So for the workers in the hospital, the thing is the right to know, and also the privacy of the patient, because some of the workers, or most of the workers, they don't really know that this patient, whether he or she is confirmed cases or not. And if he or she is confirmed, supposedly there should be more like guarding or protection for the workers. However, the hospital, they want to treat it in a low way, so they didn't provide much information for the workers. So some of the workers, when they are taking care of the confirmed case, they didn't know. And then they are going to taking care of the other regular patients. That will actually raise the risk of getting confirmed. So that was one of the problems. And at the same time, during the peak, like in the May in Taiwan, during that time, there were about like, every day is 200, 300, some cases. And so many patients are sent into the hospital, but the workers are understaffed. So the problem is that there are a lot of experienced workers who are forced to join the battlefield. So they don't really have enough knowledge to know like how they can, for example, wear the protective equipment and how to use the respirators. But anyway, they're already there. So there are a lot of medical myths and problems in the hospitals, and a lot of times it really depends on the workers. So there's no really like such a guideline for people to do the training and letting you know, like how we can deal with this virus and what kind of things we should do, that kind of thing. Yeah. Is it like Sarah is raising her hand?
Don't stop. I was raising my hand for later.
Okay, cool.
Good, sorry.
Yeah, no worries. So yeah, and so for most of the workers, like for example, especially the nurses, they are confused at the front line because they don't know what they should do, or there's no protocol, there's no guidelines for them to know what they should or they have to do. And one of the things is connected to the first one is about the confirmed cases, like who should be taking care of them. Is it a voluntary work? Like I can volunteer myself to take care of the confirmed cases, or is it have to be like designated, I have to be there? So there's a difference between the union stance and from the government. So the government said that it is compulsory, you have to do that. So it's not really like under your choice, you can choose to take care of the patients or not. You have to do that. But for the unions thinks that it should not be compulsory, because this also related to the workers' family. Like if I have a very young kids or an elderly at home, I don't really want to take the risk. So there should be a choice for the workers, but this is still on the debate. So the unions are still struggling with the management about like whether they should be taking care of the confirmed patient. But anyway, but the thing is that the right to know for the workers is very important, because if they know, if they are concerned, they will be more patient. They will be more cautious on taking care of the patient. So that's one of the issues there. And the other thing I want to mention is about the employment in the hospital, because I think it's also similar in the States. Like the janitor or the other workers are usually outsourced, or they are not really regular workers employed under the hospital. And since we had the previous experience of SARS, the pandemic in 2001, we already know that every worker in the hospital is very important. And the reason why is that in 2001, during the SARS, the breakout was actually coming from the janitors. And this is because the policy of the hospital is that we are taking care of our workers. That means only the nurses and the doctors, but not the janitors, because they were outsourced. So the janitors are not under the protection, and then it break out. So from that previous experience, we know that every workers in the hospital is very important. It's not really like you are regular workers or you are outsourced workers. You are all hospital staff, so that's very important. So this time, the unions begin to, at the very first place, they want to improve all the rights for every workers in the hospital. So for example, they fight to the government and also the management, saying that the janitors and other outsourced workers, they should have all same treatment as the staff in the hospital. So vaccination, examination, protection, compensation if they are a confirmed case, these should all be the same. And during the peak time, around like May, June, July, that time, there were a lot of patients in the hospitals, and it was actually overloaded. So the union stand up and say that we want to reduce the burden of ER, and we don't want too much patients who are not confirmed cases to come in to take the risk. And the government also helped. So they helped to relocate the patients to other hospitals to reduce the loading of each hospital. And during that time, there are a lot of discrimination against the health workers, because they think they have higher risk to get sick. So a lot of workers, they cannot go home, and if their families or friends know that she is working in a hospital, they will kind of like distance him or her. So the union figure out that the workers also need to rest, but if they cannot go home, the thing is, we think that the government should provide temp housing for healthcare workers. So there were several temp housing for nurses and doctors if they cannot go home or if they don't want to go home. So there was the from the union stance, and they fight for this. And other issues is that there were several violence against the workers in the hospital. Like, for example, the patients are being taken away to the designated room, and they attack the nurses or the doctors. And it also happened a lot in the emergency room. So yeah. And since it's really hard to say that, where did you actually get confirmed who you are, so the way is that for the unions, they think all workers working for the healthcare industry, if they are sick, it must be reported as occupational injury. and every report is very important. So the unions even provide suggestions to the government saying that you should change your protocol about occupational injury, because right now is the emergency under the COVID-19, and you should change it and expand the definition of the occupational injury to all cases, no matter you are the, no matter, whether you actually go home or you take a rest or, whatever. If you get sick and you are a healthcare industry workers, that is a occupational injury. And there are several healthcare unions in Taiwan, and each are actually based on different hospital. And so there were some cooperation between these unions, and they share their experience and also give some of the information and make sure that they have enough power to fight with their management. And one of the things is also about working hours, because during the emergency time, the government had actually raised the limitation for the healthcare workers to the working hours, the limitation of the working hours. So the unions fight back and saying that even though it is under the emergency period of time, we still think that our workers are, we are human, so we also need rest, and the working hours should still be limited. And another part about what happened in Taiwan is that because there were the emergency time, during the level 3 alert, so a lot of restaurants or business are shut down or kind of locked down a little bit. So there were a lot of needs for the delivery, because people buy things online and they order food. So there were Uber Eats and their Food Panda, that kind of delivery services. However, these workers right now in Taiwan, they are still not being classified as regular workers. So they are independent service worker. And this means that they are not under the protection of labor standard law in Taiwan. That happens to be a big problem, because there's no regulation for them to regulate their working hours and their occupational injuries. And one of the very important thing is that they don't really have the protection of the labor insurance. So during the pandemic, we had the delivery union and logistic unions coming out and saying that they want to deal with the problem of their industry right now. So for the National Delivery Union, they actually established this year. And this is because during the pandemic, the company suddenly cut down their pay for each order, and that means their pay cut. And that was under the pandemic. So a lot of the workers in the delivery union say that they are risking to get infected and to deliver the food to the people. But at the same time, the company treat them like this. So they decided that they want to establish a union. And there were a lot of traffic accident issues for the delivery workers, because you know that in Taiwan, we use a lot of motorcycle, and which takes higher risks for the workers to get onto the road. And the other part about is the logistic union. So there are a lot of increasing needs of the online shopping during the lockdown, during the level 3 alert. So there were a lot of orders during that time, and our government, the labor, actually deregulated the protections for the logistics industry, because they think it is very important to make sure that logistics works. So they raised the limitation for the working hours, and also they are having more outsourcing work in the logistic union, in the logistic industry, because there are more and more needs for the online shopping. And the problem is the government is not doing anything. So the logistic union come up and saying that there should be a collective bargaining for the regulation on these, on the working hours, and also on like what kind of job we can do outsourcing, or simply we should not outsource any work. And There were a strike during the level 3 alert, but because of the pandemic, so they don't really get much attention from the society. And so the cases was that the company divided itself into 3 individual separate company to make sure that the workers cannot establish union in each company. Because the union law in Taiwan is that we had to have more than 30 people to establish a union. So if the company is smaller than 30 people, it's really, hard to establish a union. Although you can choose to have an industrial union, that's another case. But so pretty much to say that it is the company that they want to kind of like block the way you can bargaining with me. So that's the thing. And so the workers of that company, they don't want to get divided, and they went on strike. And the whole thing goes to get to become a labor case into the court. However, because of the pandemic, so the court is also not working at all. So the legal process is actually being suspended for a very, very long time. And it didn't really help much for the workers, because they had an urgent need that they need to solve the problem right now. And another thing is that the government actually do a lot of subsidize. They subsidize the companies for like in different industry, and one of the company is their company. So the company get to have the subsidy, and at the same time they can continue to suppress the union. So that's the problem. So there are actually could be a lot of stories around there. So if you want to ask more, or we can exchange some idea later. But the thing is that although Taiwan compared to the States, we are quite under control in a way. But the thing is that these normal, or the society continue to rolling, is because there are actually workers working behind, and a lot of them are still not unionized, or they are unionized, but yet very small. Like for example, the logistics industry and also delivery union, they are still very, very small. And the medical unions, the workers in the healthcare industry, they are still company-based, corporation-based unions. So they need more cooperation between different unions for them to really to become a stronger force to change the situation in the hospitals. And well, the unions is still the very important step for negotiation, action, and transformation. But the union rate in Taiwan right now is only around like 7-8% something. So it's still very important to educate, organize, and fight. Yeah. So that's my brief sharing about what had happened in Taiwan.
Well, thank you. Thank you very much, Catta. And I mean, before we go to the general questions, maybe you can explain to people about national healthcare in Taiwan, because I know that healthcare has been privatized somewhat in China, but what is the situation with national healthcare and the zero COVID policy? Is that a discussion in Taiwan? Is there an effort to overturn the actions, the policies to stop the spread of the virus?
Well, we had a national health insurance in Taiwan, and it pretty much covered all public hospitals and private hospitals at all. So, in a way, all different hospitals, either they are public or private, they are all under control of the government, because the government can decide that I can whether I will subsidize your expense for all these medical things at all. So our government still had a quite strong control to the hospital workers or the hospital management in a way. And I think the policy here in Taiwan right now is that we are really fighting hard to get rid of the virus. But the thing is that well, it's almost the end of the year for the West countries. Is the Christmas time and the New Year's. And for Taiwan, Chinese culture, we have Chinese Lunar Year holidays in around like the end of January and February. So that would be one of the struggle for us to get control the situation, because there will be a lot of people coming back from overseas, and that will be a huge challenge for us, because compared to other countries, as I briefly talked before, we don't really have that very severe or serious situation compared to the other countries. And that also means that we don't have the experience to deal with like a huge number of confirmed cases, because it is estimated that during the Chinese Lunar Year, there will be more than 20,000 overseas coming back to Taiwan. So that will be a huge number of people if we suggested that they need to be quarantined, and if they're not vaccinated, they probably have higher risks, that kind of thing. So that will be a problem in the near future.
Okay, thank you very much, Catta. We really appreciate that report. Reports in Australia of what's going on in Taiwan and how they're fighting with COVID.
Can you hear me?
Yes, we can hear you.
No, virtually zero coverage of Taiwan and Australia since the start of the pandemic. Certainly there were the odd mention in the first year or so, but now that we've moved to, the so-called living with COVID stage, there's I would describe it as a complete media blackout on Taiwan in the mainstream press. China, you can see the situation in when it does get mentioned in the PRC, it's very quickly dismissed as, well, that doesn't relate to us because they've got a different political system, with just a blanket statement without any examination of the public health measures that are actually being implemented in China. And Taiwan, they can't dismiss because it's a capitalist country, so they just ignore. They just literally ignore it.
So, Catta, I was going to ask, is there pressure by corporations, by international capital to get Taiwan to drop its zero COVID policy? Because they are attacking China. I mentioned earlier in my report, New York Times had an article saying that China should drop its COVID zero policy, and its Business Week. Major corporate media don't like the fact that China has a policy to fight the virus or crush the virus. Is there any moves in Taiwan to have a similar policy as the United States?
I think there's a pressure from the corporation that a too strict measure on COVID prevention is too much for the companies. However, I think the situation in Taiwan is quite serious, is because during the time, the really emergency, well, the level 3 alert time, that's only like 2-3 months in Taiwan, the government actually didn't really have a very strong force saying that we are going to lock down, or there should be no companies opening up, or that kind of very severe situation. So I think the company's pressure is actually more like we want to have it's kind of like deregulated, like in a way that there should be less prevention or measures for the COVID, but it's not really that strong forces. And I think right now the problem in Taiwan is that the service industry is really under a very severe situation because the 2-3 months lockdown, if that's how we put it. But it's actually not really a lockdown, like compared to the other countries. People can still go out and there's no curfew, and the only thing is that you have to get yourself a mask and make sure you wash your hands regularly, that kind of thing. So it's not really that severe compared to the other country. And I think also the pressure is not that hard compared to the States. But I have to admit that there are still some pressure from the companies that they really want to get back to the normal. So I'm pretty sure that it really depends on later on, like how CDC will announce their policies for the near future about how they want to do the COVID zero thing.
So the 23% of the population that haven't been vaccinated, you don't have a mandate that people have to get vaccinated. And at the same time, you've seemed to have crushed most of the virus, even with having 23% of the population that haven't been vaccinated. So can you talk about how that's taken place? Because in the United States, what they're saying is to stop the virus,